Hello, I'm Dr. John Abebe, the Medical Director of Jojo Abebe Fertility Center and the lead tutor at the Jojo Fertility Academy. You are welcome once again to the Basic Fertility Training Program for doctors, and you are welcome to our Module 3. In this module, we'll be looking at assessment and diagnostics in fertility. And under this module, we have 5 different units. Number 1, we look at comprehensive fertility evaluation. 2, diagnostic tests and procedures with emphasis on male assessment. And 3, diagnostic tests and procedures with emphasis on the female assessment. And then 4, diagnostic tests and procedures with a couple-based assessment. And then lastly, we'll look at interpretation of diagnostic results. Under the comprehensive fertility evaluation, we'll look at detailed patient history taking that will include the medical, the surgical ups and downs, familiar and lifestyle factors. And thereafter, we'll take a look at the physical examination specific to reproductive health. And then under the diagnostic test and procedure for male assessment, we'll look at semen analysis, where we will look at with emphasis on sperm count, motility, and morphology. We'll take a look at the hormonal profile for male, with emphasis on testosterone, follicle-stimulating hormone, and luteinizing hormone. And then we'll look at genetic testing. We'll look at karyotyping, Y chromosome deletion. And then under diagnostic tests and procedures for female assessment, we'll look at ovulation assessment with emphasis on basic body temperature, ovulation, predictor kits. We'll look at the hormonal assay with emphasis on the hormones, the female hormones, the FSH, LH, estradiol, progesterone, prolactin, and thyroid function. And so we'll also look at imaging studies with emphasis on transvaginal ultrasound, hysterosalpingography, and laparoscopy. And then, of course, we'll look at genetic testing, we'll look at karyotyping and BRCA mutations. Under the couple-based assessment, we'll look at a combined evaluation for both the male and female partners, and then we'll look at the assessment of sexual functions and compatibility. And then lastly, under interpretation of diagnostic results, we'll look at understanding normal versus abnormal findings, and then the implications for treatment planning and prognosis. All right. So what are the learning objectives of this Module 3? This module will provide in-depth knowledge of the assessment and diagnostic tools used in fertility care for both male and female patients. It will focus on how to perform a comprehensive fertility evaluation, the types of diagnostic tests and procedures available, the interpretation of results, and how this information is used to plan fertility treatments and guide patients towards successful outcome. It is hoped that by the time we are done with this module, the following learning objective would have been realized. And 1, under comprehensive fertility evaluation, to learn how to take a detailed patient history and perform physical examination focused on reproductive health. Number 2, diagnostic tests and procedures, understand the male and female fertility assessments, including semen analysis, hormonal profiles, imaging studies, and genetic testing. Number 3, under the couple-based assessment, to recognize the importance of evaluating both partners in the fertility workup and addressing sexual functions and compatibility. And lastly, under interpretation of diagnostic tests, of diagnostic results, to learn to interpret test results, understand the implications for treatment planning, and assess prognosis. So, I wish you a very wonderful time going through this module, and I believe that by the time you're done, all of these objectives would have been achieved. Do have a wonderful time. See you at Module 4.